It is, thank you. And it's pity we haven't heard from UPMC. I think they're doing a pretty impressive job in IT. They even have a health IT company, which I had a chance to visit. It's a building of this size, just a IT company they've put together. My name is Matěj. I'm working in IBM for many years, focusing on healthcare. In the last 2 years, we are bringing artificial intelligence into practice, and this is a little bit of a where are we with this process. Thank you. And you will hear me speaking mostly about oncology and fight against cancer, which I understand is close to you too, Bas. So that's very nice to have this linkage. So first of all, we have actually created a unit focused solely on healthcare called Watson Health. It's using our artificial intelligence bigger play called IBM Watson. And our focus is on help with deepening expertise, improving productivity, and expanding knowledge base. And we've heard some of these phenomena being mentioned here already today. Too much information, too much new stuff to bring to life. Clinicians overloaded, very much spending a lot of time on repetitive processes. So that's something we are looking at. And how we can turn data, make sense of the data, and bring them into insights. And for that, we don't only just do projects and algorithms and things like that, but we've also acquired a lot of data. So we actually, through acquisition of a number of companies, we've together have a significant amount of data which are anonymized, ready for secondary use, over 300 million patient records, for example, which we are using for analytics, for big data, for real-world evidence, which I think is a key trend where IT can help transform medicine. And we are bringing it to clinicians. What is fundamentally a concept in our doing is we are not aspiring to replace humans, especially in healthcare. It doesn't make any sense. But what we are aspiring for is a partnership of clinicians, medical doctors, and technology which can help in a better way than is used from IT perspective in healthcare. Today, it's mostly documenting what happened. It is not really much helping with the medicine, but documenting what happened so I eventually can get my money from health insurance, which is important, but it's still too far from the medicine. And this is where we believe AI can kind of push the boundaries and foster the innovation because of health IT has problems with kind of getting into the clinician office. We've created a system. It has 20 years of history called Watson. Now it's a collection of technology. It's really a family. But in the heart of it, the technology understands a problem. We have trained Watson for healthcare. We have trained Watson for cancer. We have trained Watson for initial cancer types to understand in depth what the problem is about. It is able to read through millions of pages of text and thousands of clinical studies. And it's not a smart search. It understands the meaning of what the study or the article says. It is able to formulate hypotheses and is able to go to additional data sources to confirm the hypothesis. So that is in the base of what we have built our oncology systems on. And those are three, which we have currently commercially available, and we are having those on the market. Watson Oncology is the first one. The closest deployment is in Slovakia, so it is very real. This is nothing of a scientific, of science fiction, nothing which is coming in the future. It's here now. And Watson for Oncology, that's a system which basically takes data from diagnosis of new cancer patients And it is able to provide, based on referencing a lot of sources, clinical trials, guidelines, articles, how to treat the patient. So it's a clinical decision-making support for oncologists who's able to bring with a prioritized list of treatment considerations, where again the oncologist will decide on how to treat the patient in the end. Okay. What is important is that it is allowing oncologists to directly access evidence-based. So with one click, you have the study, you have the article, you have a guideline which is speaking about this profiled stage of a disease, type of patient currently sitting in the clinician's office or currently being discussed on a tumor board. So very powerful, online, right in time. I think that's one of the key problems of health IT, that there's a lot of good, but not being able to be delivered in real time, in time of when the clinicians need it. So this is where we were focused a lot on. You can also compare treatment options side by side. You can compare different chemotherapies. You can compare chemotherapy, radiation therapy, or surgery next to each other. Very, very powerful. We have over 200 hospital chains around the globe, 5 continents using it, and hopefully we'll be getting to our environments one day as well. The other one, clinical trial matching. Clinical trials, big problem mentioned here already. So in oncology, specifically, organizations in oncology have difficulties to find patients. You need to find very narrowly profiled patients because of the studies are very, very focused on sub-problems of sub-problems these days. And what we have done, so we have used the capability of Watson to read and understand medical literature and studies for being able to parameterize inclusion and exclusion criteria for clinical studies. So Watson is able to read through a clinical trial, which is free text basically, and generate parameterization of inclusion and exclusion criteria, and then take patient data and match patients to clinical trials, or the other way around, can match the clinical trial to patients across different institutions. And we have actually trained it with the Mayo Clinic, and they have been announcing recently a significant achievement of about 80% improvement of patients on clinical trials in the case of breast cancer, which is significant because of today, the number of patients who could go into clinical trials where the current treatment is not working is way below the reality of how many patients get into clinical trials and can benefit from that trial, but also the trial and research would benefit from having that patient in. And lastly, we have trained Watson for genomics in cancer. So what it does is that it is able to clinically interpret somatic mutations based on biopsy and then next generation sequencing of tumor cells, cancer cells, where this work typically takes 2 to 3 weeks of a very highly skilled molecular oncologist or a molecular biologist. And we've trained Watson to do that in a matter of about 2 to 3 minutes. And Watson is able to, and I'm not sure what I should do, okay. And Watson is able to come back with profiling of the mutations, analyzing mutations, what are the driver mutations, what are other mutations, what are actionable mutations, what are the drugs which could be considered for these particular mutations, what are the clinical trials which are focused on these particular mutations, and also what are even some off-label considerations for cases where there's no mainstream medicine. So something for molecular tumor boards or molecular pathologists saving a significant amount of time of the manual work they're doing today. And we have started to publish papers. So, for example, for the later case of genomics, we've worked with University Hospital in US, where on their molecular tumor board they were able to, in a cohort of about 1,000 patients, find, or Watson was able to find 30% more actionable treatments than the panel of experts they have. So significant improvement and new possibilities for patients to get personalized treatment. So we are pretty proud on that. Okay, that's it. Thank you.